and we're starting to pull in the parking lot, I noticed my mom's right hand start to slide off the wheel and turned into the spot and bumped into the car. So I was saying, hey, can you hear me? And yelling at one point, and she couldn't, so I called my dad, and I was telling him something's wrong with Mom, and he said hang up and call 911, so I did. And I looked over at my mom, and her right side of her face was drooping, and she was starting to drool, and that's when it clicked from my training years ago that she was having a stroke. So right then I told him, I'm 95% sure that she's having a stroke or a seizure.
So I got to the site, the scene of the accident, wrapped up with the police officer, and then grabbed Evan, and we headed right for St. Joe's Hospital.
You know, immediately her symptomology did present that she was having a stroke-like symptoms. And in fact, the type of stroke that we call left MCA syndrome, meaning that she had, you know, a difficulty with speech, she had right-sided facial droop, right arm, and as well as she was having some lower extremity weakness too.
There were several nurses nearby tending to her, taking her vitals and everything else. At that point, they wheeled in the TV basically on a cart.
And Dr. Pandya was on the other end.
Sir, this is Dr. Pandya, one of the stroke neurologists.
And we stepped in down to the foot of her bed, and we could see him moving the camera over, and we talked to him about what happened.
The Telestroke monitor then is brought to the bedside for a doctor then to immediately be able to visualize the patient via the telemonitoring device.
We're able to interact with the patients and see the patient and the family. And more importantly, the treatment gets started faster than they can imagine. Time is brain, so every minute you waste getting the treatment started, there's less chance that they're going to have a good outcomes. Debbie, who had a chance of 80% mortality. She had an 80% chance that she was not going to make it out of the hospital. If she would have made it out of the hospital, she had a 60% chance that she was going to be in a nursing home with a feeding tube. But because we were able to evaluate her on time, because her son was able to bring her to the hospital, recognize the symptoms, we gave her the clot-busting medication, and then we took her for a procedure where we removed a big clot out of her brain, where she actually walked home within, I think, day 2 or day 3.
I can't imagine a 13-year-old boy sitting there watching his mom having a massive stroke. It's heartbreaking for me. Had Evan not reacted the way that he did, and if the technology had not been present at the hospital, I wouldn't be the 90% that I am right now, a year and a half later. I wouldn't probably even be sitting here right now.